Hi, my name is Dr. Eric Miller with Chiro-Med Health and Wellness Centers in Orland Park, Illinois. Today's video topic is going to relate to upper back pain and chest wall pain. Traditionally, when patients come in complaining of pain in their upper back, they're going to complain about spinal-related pain, which is square in the center of the spine, or pain just off to the side of the spine between the spine and the actual shoulder blade or scapula. That pain is usually right in this particular area. One of the most common areas to get that pain is between the T4 and T5 vertebrae. There's a condition called T4 syndrome that relates to the upper back rib vertebrae misalignment, and it's very common. And what that is a problem where there's a misalignment in the vertebrae and the rib connection. So whenever you've got a misalignment of the rib, it can have an effect on the intercostal muscles that are the muscles between the ribs, and also inflammation of the joint between the vertebrae and the rib itself. Now again, a lot of times you'll have pain in the upper back, sometimes you'll have pain that wraps around the chest wall, and sometimes it can even be in the front of the chest. And that's basically coming about from referral pain coming from the rib. A lot of times whenever there's misalignment at all in any particular vertebrae, you're going to have a muscular reaction around that particular area, and the muscles will get hypertonic or tight, and sometimes even spasm. So what we do in this particular case, once we rule out that there is no problem with pleurisy, there is no problem with a heart attack, then we're going to go to the musculoskeletal component of it, and we're going to really check out the thoracic spine and the rib and the connection between those two. You can even start to pinch a nerve that comes between the ribs, known as the intercostal nerve. I'm going to show you the x-rays right here of two different cases. One is more complicated and one is pretty simple. Let's go ahead and look at the simple case first. You know, when we look at the vertebrae, what we want to see is that everything is in line, perfectly straight up and down. And there can be some small deviations, and those deviations are sometimes symptomatic and sometimes not. But if you've got a patient that comes in and has the pain that we're talking about, with pain between the shoulder blade and the spine, pain that could be coming around to the front of the chest, or maybe even referring down the arm, this is where we want to look at. T4 syndrome happens when the T4 vertebrae is misaligned, and that has an effect on the ribs that come out and wrap around and go to the front of the chest wall, meeting the sternum. Even a subtle misalignment like this can cause enough irritation to create those symptoms. A more severe case would be something that we see commonly with scoliotic patients, where you've got a curvature through the spine and there's a lot of rotation, a lot of lateral bending, and of course that's going to create more misalignment in that particular area, which invokes more inflammation, more possible nerve pressure, and a more muscular reaction. So typically what we do in this case is evaluate it thoroughly with an orthopedic and neurological examination, do x-ray and see what it looks like and see if there is misalignment in that particular region, and then find out if it's going to be something that needs to have manipulation performed. We'll also do stretching of the intercostal muscles, stretching of the rhomboids and the lower trapezius muscle. Any particular muscle that's affected as a result of the misalignment here, we need to do work on. So muscular work basically consists of stretching, of muscle work such as massage or trigger point therapy, but then again, manipulation does a great job of releasing that kink in that particular area, and then the ribs will then begin to elevate and depress. Another symptom that a lot of patients that have T4 syndrome present with is a shortness of breath. So again, it kind of mimics a heart attack, but the reason they can't get that full breath in is because the rib cage isn't expanding when they inhale and depressing when they exhale like it should. So that dysfunction, that rib vertebrae connection, isn't allowing proper rib movement, and the patients complain that they're not getting adequate breath. Generally, after manipulation, they'll notice an immediate improvement in their ability to breathe, and they may be a little bit sore still, you know, after the first adjustment, but the muscles are going to tone down, the ribs are going to be able to move like they should, and generally they get a pretty good relief of their pain that they present with. If you have any questions concerning rib pain, upper back pain, chest pain, you've been to the doctor and they just really haven't given you a good answer on what could be causing this, give our office a call, 708-403-2727. Thank you much.